Good afternoon, ladies and gentlemen. This is OVAUA with a profile. Today is a Saturday here at PDIMtv, and you're more than welcome to come and join our program this afternoon. We are in very trying time, but we managed to bring one of the health professional to say. That is Mr. Alfred Nakanyala that have just joined us this afternoon. Mr. Nakanyala, how are you?
I'm very blessed. How are you, my brother? Wow.
I'm doing very fine as well.
Okay.
Now, we are going to talk about COVID-19 as the topic of today is health professional and COVID-19 epidemic. And if you have any input, if you are a medical person or a medical doctor, please do call us on 0814-130-717. That is the number on the studio. Here to be part of our program this very beautiful afternoon on Saturday. Now, we are going to look at a lot of things. Namibia in the recent weeks have been having a lot of spikes. I mean, spike on the increased number of COVID-19 cases. The country has been in a very dark time of our lifetime. You have lost many people that we know of. And like I said the last time, that the number of cases have turned into names of people that we know of, the names of our family members, name of our friends, name of our leaders. As being people that are being sucked up to the COVID-19 epidemic that is really has become very deadly in the recent weeks here in the country. And you can tell that many countries are now also trying to take Namibia out of Namibia is being seen as one of a no-go area because of the new spike into COVID-19 cases. And that's what we are going to look at today.
Oh, yes.
Yes, in the studio. Now, briefly tell me who's Mr.
A first live responder because it's a passion that I love, basically. I love helping people, and it's always been it's just the thing that is inside of me, of just wanting to render health and wanting to help the next person. Yeah.
So you are one of these people that says, yeah, another person's life's made is yours as well. Now,
yes, a brother's keeper.
Yes. Now, we thank you very much for bringing us to that point. The country is experiencing the increase in number of cases of COVID-19.
Oh, yes.
And we are also the number of people that are also dying due to the COVID-19 and related to death.
Yes.
It's increased in the last month, if not in the last weeks, number of weeks.
Oh, yes.
Yes. What do you think we're not doing right? Just from a health perspective, what do you think is lacking in our society?
Okay, sorry to cut you off. First of all, what I'll say is that we're the way you treat the flu is you eat your fruits and do some it's the same as having to take care of a flu, should I say.
Yes.
We're just not doing things where we're having to wash our hands, because these things can be spread by germs, and not taking care of ourselves, washing our hands and wearing masks and should I say.
Now, many people are talking about a lot of things. Some are saying, people are coming up with lies to say about this new virus in our midst. Some are saying you cannot be healed by certain things, can be healed by certain things, but yet our people are losing life every day. So what do you think is is lacking. Do we lack the scientific perspective in the country? I was saying we don't have enough scientists in the country that will give us. I mean, that would have enough research into COVID-19 and give us what is expected from the nation, because our people are being bombarded with information, sometimes being it wrong information, sometimes information that helps some people at the same time. We are having a lot of things, like people are saying this Ivermec, the talk of the nation. People are talking about Ivermec here. Doctors are saying no, this is not the right way to take. It's not good for your kidneys. Others are saying it's helping in COVID-19. On COVID-19, it's healing people. Some people are coming with the, I don't know if it is the truth or the lies, but being healed because of using Ivermec per se. Others are saying this and this and that. What do you think is lacking? Where do you draw the line? Where do you see ourselves here? What should people do?
In my understanding is that people, the way we spread rumors so fast is that we don't truly have a total knowledge, a total understanding of how things are working. Because when we're looking at our country is a very, it's still in the process of being developed, right? Where I wouldn't say we're not developed, but then if looking at this new vaccine that just came from developed countries, is that developed countries, they have their technology and their scientists are on another advanced level compared to our scientists. Because if you have to look at this sickness, right, is that it's a very curable sickness, because if it can be cured with things such as steaming and taking your flu. The onions in your house, having onions cut and just have them like around in your house is also good. It kills also bacteria. And also if we're looking at this pandemic and sickness, we're looking at it from because I myself am also a believer, we're looking at things that biblical and traditionally. Biblical in terms of believers, we're putting our trust in God, right? Because God is the healer, right? And believing that indeed this sickness will go if we put our trust in God, and also taking our medication. Traditionally, we have our elders that believe that those years when such a sickness was there or such illness was there, they would use herbs and all those. But we have different beliefs. You have beliefs where scientists only believe in medication, but then we also have people that believe in medication and biblical things. Biblical, where you'll pray and someone will get healed. And not only your prayer, but also having your medication. So just do not put your trust, just do not have your focus on your medication, but also put your focus on medication and in God.
You're bringing me to one of my favorite author of faith. I mean, faith and belief. That's Dr. D.D. Price. He was saying that a faith is taking an action. Believing in something else. We are not going to talk about that today because we are on a different mission today. And thank you very much for bringing into some of those things, because many people out there saying if you are a believer, don't to respond to people that are directly facing these people on the first meet. You saying if somebody is infected by COVID-19, the first people to go there are the paramedics, isn't it?
Yes.
So what are the benefits? What are the risk of these people that are into the department or the industry that you have chosen for yourself?
This industry, I'm just not doing it for myself. I'm doing it to save others, to save lives.
Yes.
To save lives, because you'll come at a point, or you'll find yourself in a situation where you would find a family member being affected with a certain sickness, and you wouldn't know what to do. But then with this sickness, I mean with what the career that I chose to, or the profession that I'm doing, is that it has its side effects, or it has its negative. Because first of all, what you do is that you're faced in a situation where you end up going, you are called, or you end up going to a scene, and you don't know what to do. But then obviously they teach you how to be protective, because you obviously need to know that, okay, fine, I'm going somewhere, but I need to have my mask, because these are animals. And you need to always protect yourself, always, every time. And it can affect you. It can affect you physically and mentally, because mentally, going to a scene and it's your family member, right? And you don't know what to do. That's why you need to be someone that has a very strong heart. You need to be someone that has a very strong heart, and you need to be someone that's very sensitive and not ignorant, because at the end of the day, you end up treating someone. It's another life that you are rendering service to. So you need to know that if I'm treating this person, I need to make sure that I'm wearing my gloves, having protective equipment or protective gear, such as gloves, your face shield, or your mask.
Okay.
And just don't always go there wearing jeans and all, but you need to have the right equipment and the right people to go there.
Now, I just heard you saying it's an airborne disease.
Yeah, it's an airborne disease.
Has it been confirmed as being an airborne disease?
Yes.
Or are we still waiting for scientists to confirm whether COVID-19 is an airborne disease, or just a disease, a bacteria, or something that you can only get when you touch where somebody was, or these things that we are protecting ourselves from, that we have been protecting ourselves from since the beginning of this epidemic?
What I said earlier is that when I said it's an airborne thing, is that this thing, it works, it's in the atmosphere, right? And it can be transmitted from one person to the next person. To the next person, where that's why they say that we should always keep 1 meter away from one another. 1 meter away from one another, because this thing, no one knows when it can be transmitted, or you can get it from one. You're not sure whether I have it or not. That is why they always recommend you to wear a face shield, to make sure that
when you are afraid of COVID, let's say general sickness in there. Let's start with it. Be the first one at somebody who is being affected by COVID-19. Although we are human beings.
Yeah.
Yes, we are human beings. You coming from the paramedic, and you are approaching somebody that is on his dying bed.
Yeah.
And then what are the psychological effects?
um, you arrive there and the person is sick, but you don't know what's wrong with the person, right? And then risk, you can be, this thing can happen very fast. These things can be transmitted very fast to the next person. And you can get it very fast, but then without you knowing, because what you should have in mind is that you should always have your protective gear. Always, wherever you go, you should always have your mask, because you never know. Not only COVID-19 is the one that can affect you, but you can also be other sicknesses can also get you. That are also airborne.
Let me ask you another general question. Do you think the current
I need to make sure that wherever I'm going.
That's every time when you're coming. Sorry for disturbing.
Yeah.
Are you suggesting that every time you're coming out of your house? I mean, if you're coming out from wherever you're coming from, and you're entering your house.
Yeah.
You should remove your shoes.
You remove your shoes.
Steam before.
And steam before.
Before you start with everything.
Yes.
We have one of the contributor, that is Alexander Dimitrievich. Lord God, to cut off all the witch of the general spread of the witchery between me and all other people. Thank you very much, Alexander, for your contribution. It's highly appreciated here at PDIMtv. Yes, the timing.
Yeah.
I was talking to one of my nurse, who's a friend of mine, and he was saying, man, the timing of being a nurse is wrong. His timing of being a nurse is wrong, because he just started recently, and then he has been approached with. He has to confront COVID-19 in his first years of practicing nursing in the country. That's what, when he was telling me now, the timing is not fine.
Oh, yeah.
Are you saying the timing of being in a paramedic is fine, especially during this time? Because you mentioned that yours is a calling.
Yeah.
What you want to do is to help people. That's being, not being, you don't want to be yourself. You also want other people to benefit from whatever you're going to do.
Oh, yes.
What do you say? Are you saying the timing is fine for you to be in the profession that you are in, or are you saying, yeah, because I'm risking my life? You're risking a lot of things. It's like I said, it seems like it's also a psychological problem that we are going to face at the end of this pandemic.
Oh, yes.
What do you say? Is the timing fine? Are you saying, the timing is wrong? I should have done something else to save my life?
I would say that the timing is not wrong, or what I chose is that I did it at the wrong time. But then I would say that it's good that I went this at the right time, because with this you need to be prepared for all situations of life, all matters of life, right? You were looking at we need to be able to save others. We need to be able to save others that are being affected in every situation. In terms of we need to be able to save, to be prepared. In life you need to be prepared for everything. You need to be prepared for everything, because I'll say that you just need to be prepared for everything.
Now, because like when in the beginning I said the number of cases that were reported in the beginning, we were just hearing 10 people have been, infected by COVID-19.
Mhm.
11 people, 45 people.
Yeah.
These people have just been a number of cases.
Mhm.
Now, the number of cases has turned into names of people that we know of.
Yeah.
Now, imagine you are walking into this thing, like yourself,
Mhm.
and then you're hearing names of people that you know of.
Yeah.
People are being that are succumbing to the current epidemic that is in place.
Mhm.
And then you are saying it's the right timing for you to be in that position of saving these people's lives, or trying to save these lives.
Mhm.
And then at the end of the day, you're trying to save these people's lives.
Mhm.
You try to save somebody's life today, and then tomorrow you are hearing that somebody that you took from what location. Let's talk about this in a general way.
Yeah.
Some people are losing their boyfriends
Mhm.
because you are a nurse.
Mhm.
You are working directly with these people, or your girlfriend, boyfriend's situation. People are losing loved ones. Losing relationships.
Yes.
Because somebody is saying no. If you are saying if you are saying you are going to be continue doing what you are doing currently now,
Mhm.
I don't think we should continue with this relationship because you are going to risk my life. I'm not working into the health sector.
Yeah.
I'm not part of your I'm not part of your routine, because
Yeah.
you are every day, all day of your time you are confronted with this.
Yeah.
You are treating, and you are also witnessing them losing their lives. And somebody saying it's high risk dating somebody from this thing.
Yeah.
It has become another problem.
Mhm.
What do you think should be done? Because, like I said, I want us to look at it on a psychological level.
Yeah.
Do you understand?
Yeah.
If these people are losing their partners into relationships, because partners are afraid of being directly infected with COVID-19, and you have also witnessed in the past weeks that many of our health workers or health takers, health care takers, are being infected in numbers.
Yes.
You understand?
Yes.
They are being infected by COVID-19 in numbers. Do you understand?
Yes.
And that's very bad as well to the society. We are feeling the pain of us not having enough health workers in our health sector.
Oh yes.
In a trying time like this one.
Yes.
And then there are those ones that are saying, if I'm dating you and we are in a relationship, and you are still working with these cases, with these people, please, I'm not going to be part of this relationship anymore. What is the message to them? What will you tell them? Are you saying, just accept it and move on? And then what do you foresee after COVID-19 in that regard?
Okay, I like your question.
I don't know if I've made myself clear into that one, but hopefully I have.
Okay. First of all, as you're saying that others are just accepting what's happening, but then I would say that at the right, you need to be someone that are you willing to take the risk, because you would find in situations where you are working as a medic, but then you find that your partner no longer wants to be with you because they feel that they are
being exposed.
They are being exposed to what everything you're going through.
Yes.
That you're going through. You would find that you after a day's job you are stressed, and it also affects you and your partner. And with this career you you need to a partner. You need to have a partner, or you need to be someone that's where you're in a relationship, your career is not being affected, because once your career is affected by those things, it can affect you mentally, psychologically, and mentally, where you end up having suicidal thoughts. You start doing you create a habit. A habit is formed inside of you, where you end up smoking. You become an alcoholic. You start having less. You have sleepless nights, and you just become something else.
So you are talking about self-esteem.
Yeah, self-esteem. You need to have self-esteem,
yes.
And you need to be someone that's very good, with a strong heart, man. With a strong heart, and you need to be someone that's very open. Very open. You just cannot keep things inside of you where you lost a loved one, but you don't talk about it, or you don't to talk to someone about it. You need to be someone that's very open, and someone that's very you need to create yourself hobbies or something that you off this thing. Like can just keep you
not into relationships.
Yeah.
Let's talk about family relationships.
Yeah.
We are coming from home where we have elders.
Yes.
And you can see that many of our elders are being have really succumbed to this disease recently, or we have people that we you seeing somebody that you yesterday, that communicating yesterday, who was having hope yesterday.
Yes.
You understand?
Yes.
Who just succumbed to the disease. Because COVID-19 seems like it's no more being selective in any way.
Yes.
You understand?
Yes.
And then our family members that we are exposing to this pandemic.
Yes.
What are your takes on it? Because we are saying you are as a first aid person now. You go to somebody that has a problem with COVID-19.
Yes.
Now.
Yes.
And then after work, you have to go back home.
Yes.
To your parents. To your relatives.
Yes.
That are home. And these people are saying, Niyama, these people are exposing us to COVID-19.
Yes.
You understand? Because
Here where you say that where you say that where people are being exposed to this, what we're going through, and my word of advice is that we just need to adhere, man. We just need to adhere to the regulations and just do our best, and obviously not obviously I'll say that remove your gears, right? Remove your gears and just steam and just steam, and you need to steam and take in your try to be as healthy as possible, man. Try to be as healthy as possible, and
what message would you give to somebody that is living with not with COVID, but who's living with somebody that works in the health.
In the health, okay.
In the current situation.
Okay. In the current situation, my advice to that person is that as you're going out there or as you're coming back home, and you know that you're working in the health sector and you're exposed to people that are being affected by COVID-19, try your level best not to always always make sure that you're always tested every day. Let me say, every week you get tested. You need to make sure that you're always tested every week, and you make sure that make sure that you're always tested every day, and maybe if you can, try to maybe bath every day. You're bathing every day, you're staying every day. Pray. I'll say that you should pray that every time that you're going out of you're leaving the house, you're making sure that you don't get affected, and that's my advice. And keep up the faith. Make sure that
we should also give support to the health personnel that you are staying with.
Yes.
That should be one of the messages that should be giving out to people that are living with people that are in the health sector.
Yes.
Support giving is one of them.
Yes.
Because we are living with our brothers and sisters, uncles, mothers, and aunts per se, that are working into this industry.
Yeah.
And they are being exposed every day of their lives.
Yes.
Them trying to save lives.
Yes.
You are trying to, like you said, your aim or your vision is to save lives of people that are out there. Do you understand? And then we are living in a society whereby some people are saying, if you are working into the industry in this very difficult time, in this trying time of our lifetime, I don't want to be exposed to COVID-19. That's what family say, that's what friends and relatives are saying. If you are bringing into COVID-19 into our home, we don't want you anymore. So what needs to be given is more support to these people that are living with us.
Exactly.
And then we also need support system.
Yes.
We I don't know if Namibia is doing it, but I heard that many other countries are also giving this psychological support.
Yes,
to the health workers.
Yes.
To patients as well, because what I've also realized is that many of our people are dying because of them not being given enough information about COVID-19. I'm not saying our government is trying its level best.
Yes, exactly.
It's trying its level best. All is that it can do. But what I'm saying is maybe somewhere, somehow, our people did not get enough information on what to do when they are approached by COVID-19. Do you understand?
Exactly.
There are a lot of things that needs to be taught to our people. During this epidemic, because otherwise we are going to live with people that are dying of heart attack, because if somebody heard that you are infected with COVID-19. Some people are dying of heart attack. That's what we are hearing out there. People are dying of heart attack after hearing that they are infected with COVID-19. COVID-19 is not a disease like all the other diseases that were there before us, but this is a new disease. You understand? So we need support systems that are going to help people to move forward, especially people that are working into the health sector, like yourself and nurses, doctors, and them. Now, ladies and gentlemen, like I said, we here at PDIMtv. This is Profile with me, OVAUA here in this very, very, very beautiful Saturday. We let's say it's a beautiful Saturday, regardless of the fact that we have lost many of our people. Many people have succumbed to the epidemic that is out there. But by God's grace, we are still moving forward with PDIMtv here. If you have any being it a question or anything, please do call us here in the studio on the number 0814130717 and bring us your input. And I don't know where you're watching us from, but if you are one of those people that think you have contribution to make to this very, very interesting topic, to inform our people that are out there. People need to be on the effect of COVID-19. The people need to be informed about what they should take, what are the first things they should do when they suspect that they are being infected by COVID-19, you understand? So we need anybody that is out there to come on board and please join this program this Saturday. It's your program after all. I have this program to the people that are out there because I cannot do this because our people need to bring in their voice. We have a lot of experts. If you are a health expert, if you are a politician, anybody that think you have a contribution to make today at this very, very conjuncture, please join our program this afternoon. And let's meet after this very short break.
You are free. You are one to it's where adverts and encourage all those that want to do nice posters, nice video adverts. Maybe you want to do a musical video, or maybe you want to do a wedding video. You are free at liberty. Come and check on us for your best advert, for your best wedding video shooting, and maybe for your music video shooting. Come and check us. We are just in Windhoek, the capital city of Namibia. Welcome to PDIMtv. All those that want to advertise with our TV, you are free and you are at liberty, because we are one of the TV stations that is giving good rates to adverts where adverts is concerned. And again, we want to encourage all those that want to do nice posters, nice video adverts. Maybe you want to do a musical video, or maybe you want to do a wedding video. You are free at liberty. Come click on us for your best advert, for your best wedding video shooting, and maybe for your music video shooting. Come and check us. We are in Windhoek, the capital city of Namibia.
Yes, thank you very much, and welcome back to the profile here at PDIMtv this afternoon. Like I said, we are discussing the health professionals on COVID-19 pandemic, and like I said before, I'm joined by my brother here, Nakanyala. He is a paramedic. No?
Yes.
Paramedic. He doesn't want me to mention the word professional, but yes, he is. That's who I am with here in the studio. Ladies and gentlemen, we are going to continue with our program here today. Like I said, if you are out there and you want to join our program this afternoon, the number is 0814130717 here in the studio, and to join our program. I'm OVAUA Koima with the profile, and it's a beautiful Saturday, like I said. Now, Mr. Nakanyala.
Yes.
We are experiencing a lot of things.
Exactly.
In trying time like this, we have a lot of people that pretend to be carrying this type of diseases or this type of viruses. We have been experiencing this with HIV and AIDS. We have been experiencing with this cancer and many other epidemics that have came before COVID-19.
Oh yes.
Yes, we have medical doctors that are out there saying, Doctor who is going, I'm having what medicine that can cure COVID-19. We are also with traditional doctors.
Yes.
That are also saying, I'm also Doctor who.
Yeah.
I can cure COVID-19.
Oh yes.
We are also having con men and con women who does not fall into under any what should I say? Under any profession.
Yes.
Yes, or belief or what.
Oh yes.
Con men and con women.
Yes.
That are selling medicines out there, it's claiming that they are going to help keep the disease that is affecting us. And because our people are fearing from COVID-19,
oh yes.
They are going to these people. What do you see about it?
I would say that this, guys, first of all, with, as you mentioned, the fear. What's mostly the other thing that I actually wanted to mention is that our people are dying because lack of what? Lack of knowledge, lack of fear. Fear is also one of the things that is also killing you, because you find that someone affected, or you personally yourself is affected by this sickness. You don't know what to do. Why? Because you don't have enough information in that type of situation where you just do not know how to get cured by this, because you have this lack of fear to die. You end up going to this con man and con woman that are busy selling this antidotes or vaccines, and you haven't got enough information to know if whether that, or you haven't done your research on that, whatever is being sold by that certain individual. You end up buying those things with the hope of wanting to get cured.
Yes.
With the hope of wanting to get cured, you end up putting yourself at risk. You end up putting yourself at risk, and that person, social person, is out there selling fake information to that person. This con man, or a health profession, is here busy killing lives without thinking that no, he's killing lives. He's not thinking of what if I kill this person, but he's not thinking. He doesn't have. He's just busy thinking of how you call. He's having he's